Module 1, Introduction to HIV/AIDS. This module gives basic knowledge about HIV/AIDS. The participant, after attending this module, will learn fundamental knowledge regarding HIV/AIDS, such as what is HIV and AIDS, the structure of HIV, natural history of HIV/AIDS, modes of transmission, risk factors and risky behaviors, pathogenesis and diagnosis, epidemiology of HIV/AIDS in Pakistan, global situation and regional situation. The participant will also know UNAIDS fast track strategy, 95%, 95%, 95% strategy to HIV/AIDS globally, to end HIV/AIDS globally by 2030. What is HIV/AIDS? HIV is the name of virus, while AIDS is a late stage of HIV infection. The abbreviation HIV means human immunodeficiency virus. It's a retrovirus and has two types, HIV-1 and HIV-2. HIV-1 is prevalent all over the world, while HIV-2, which is less virulent and is prevalent in some parts of Africa. The abbreviation AIDS means acquired immune deficiency syndrome. When HIV-infected person develops signs and symptoms of disease due to irreversible damage to immune system, it usually takes about 8 to 12 years for someone with HIV to develop AIDS. The structure of HIV. It's spherical in shape and about 100 nanometers in diameter and is surrounded by lipid envelope having spikes. These are the knob-like structures. Glycoproteins GP41 and GP120. These spikes help HIV to attach with host cell, which is target cell, and it is known as CD4 cell, such as T helper cells. Genome of virus contains two strands of RNA molecule. Two viral enzymes are important. Reverse transcriptase viral RNA converts viral RNA to DNA. Integrase helps virus genome to integrate with host cell. Replication occurs along with the cellular replication. Enzyme protease help to form new mature HIV viruses. Modes of HIV transmission. Transmission of HIV virus from infected person to other occurs through exchange of body fluids. Three body fluids are important in transmission of HIV: blood, sexual secretions of men and women, and milk of HIV-infected mother. Common modes of HIV transmission: unprotected sex with HIV-infected person, transfusion of infected blood or use of contaminated needles, syringes and other instruments, from HIV-infected mother to her baby during pregnancy, labor, and when mother feeds baby with her milk. How HIV is not transmitted? HIV is not transmitted from infected person to others through casual contact, such as by looking after HIV/AIDS patient, living with HIV-infected person, eating together, swimming in the same pool, or using same toilet. Natural history of HIV transmission. Target cells for HIV virus are cells with CD4 receptors, mainly T lymphocytes. They are also known as T helper cells. When HIV virus enters the body, it integrates with the CD4 cell receptors. After entering the CD4 cell, HIV virus converts its RNA into DNA by using reverse transcriptase enzyme. The HIV DNA integrates with host cell DNA. The enzyme integrase helps the integration process. HIV DNA then instructs the host cell to make many copies of the HIV virus. New HIV viruses are formed with the help of enzyme protease, and they are ready to infect other CD4 cells. Seroconversion. Antibodies are formed by host in response to HIV infection. The appearance of detectable HIV antibodies is called seroconversion. Usually, it takes 6 weeks to 6 months for antibodies to appear. During this period, virus is present in the body, but there are no detectable antibodies. This period is called window period. Acute retroviral syndrome, or ARS. Clinically, patient presents with flu-like symptoms such as fever, sore throat, body pain, skin rashes, and enlargement of lymph glands. Mostly it is not recognized at initial clinical presentation of HIV infection. Patient is highly infectious during this stage. Asymptomatic stage. After acute retroviral syndrome, HIV infected person remains asymptomatic for a long time, usually 8 to 10 years. During asymptomatic stage, HIV infected person looks perfectly healthy. HIV can be diagnosed only through HIV testing. Asymptomatic HIV infected person are commonly known as HIV positive person. Symptomatic HIV infection or AIDS. When HIV positive person develops signs and symptoms of disease, he or she is called AIDS patient. CD4 cell count decreases, falling to less than 500 nanometers. Normal range is about 600 to 1200. And common symptoms and signs of AIDS include loss of weight, prolonged fever without a known cause, repeated episodes of diarrhea, oral esophageal candidiasis, skin infections, and opportunistic infections such as tuberculosis, pneumocystis carinii pneumonia, toxoplasmosis, cytomegalovirus infection, and Mycobacterium avium complex. Diagnosis of HIV. HIV cannot be diagnosed on the basis of history and clinical examination. HIV test is must for the diagnosis. World Health Organization recommends 3 test strategy for HIV diagnosis. HIV care continuum. It's a public health model which discusses how people with HIV get diagnosed, engage in medical care, receive ART, and achieve viral suppression up to undetectable level. Steps include HIV diagnosis, immediate linkage to care, initiation of ART, ART adherence, achievement and maintenance of viral suppression. Epidemiology of HIV/AIDS. In 2021, 38.4 million people were living with HIV in the world. Of this total, 54% were women. That means women were more than men. There are more women living with HIV than men globally. 1.7 million were children. 1.45 million people became newly infected with HIV. 85% of people living with HIV in the world knew their HIV status, and 28.7% of people living with HIV were accessing treatment in 2021. HIV/AIDS in Asia. Our region, Asia, is second only to Africa, with greatest number of people living with HIV. The data shows new HIV infection in Asia, including Pakistan, are increasing. In 2020, 2.3 million people were living with HIV in India, our neighboring country. Similarly, in China, there were 1.045 million people living with HIV. HIV/AIDS in Pakistan. Pakistan currently is experiencing concentrated HIV epidemic in the country. HIV prevalence among several key populations is more than 5%. HIV epidemic in the country is driven through injecting drug use. HIV prevalence among general population is still low, is about 0.2%. Number of estimated HIV/AIDS cases at the end of 2021 were about 210,000. and 25,000 new infections occurred in 2021. Less women are living with HIV in comparison to men. It's about 30% of total are women. HIV outbreak reported from Ratidero in 2019, more than 900 children tested positive for HIV. UNAIDS fast-track strategy to end AIDS by 2030. 95%, 95%, 95%. It means 95% of those living with HIV know their HIV status. 95% of those who know their HIV status to be on ART. And 95% of those who are on ART are virally suppressed. Where are we? People living with HIV in Pakistan, 240,000. Those who know their HIV status, only 20%, 49,584 people. Those who are on ART, 29,026, it's about 60%. But we don't have data regarding virally suppressed.